I would like to present to you some of our apps for the upper and lower limb rehabilitation, which means, of course, in the context of our recovery system. Quick outline of this talk. I just give you one slide of what is recovery in a nutshell to just remind you again our approach, because there are some small differences in how each group is doing it. Then I would like to present to you our recovery at home application. And then I would like to show you also two games. So this fits good to the previous presentation of Javier. So we're also working towards gamification to make the rehabilitation a little bit more interesting, a little bit less boring. Before that, just 3 slides that came in briefly. So I'm happy to announce this invitation by our recovery gym in Frankfurt. They have an opening, the text here is in German. They have an opening event on Tuesday, the 28th of May. If you're around in Frankfurt, please have a look there. Go to the opening event. You see here the schedule and a QR code. I will also present this QR code again on the very last slide of the talk, so you will have enough time to scan the QR code. Don't worry if you are now not fast enough. Or also you could, of course, watch the talk again in a YouTube video, send emails to Daniel, or use the QR code, come there and watch the great opening of this gym. This is the staff of the gym. They just finished their training. As you can see, congratulations to all of them. Here in the middle, the trained persons, and this is Wusang and Unal, our well-experienced trainers. But now back to the topic. So how do we do our recovery stroke rehabilitation? We are measuring the brain signals from the EEG, and then we have these 2 modalities of real-time feedback. The visual feedback, where we show the avatar of the patient in the first user's perspective. In this case, it would be the rehabilitation of the upper extremities. So you see both hands of the patient. And then we apply functional electric stimulation on the hands over the muscle that should be stimulated. So either here or on the leg, if there's the rehabilitation for the legs. And they are doing the movement in parallel. So as soon as we detect correct motor imagery, we switch on the feedback devices, the visual feedback and the fast feedback. As soon as the correct motor imagery disappears, is not detected anymore, we switch off the feedback. So we have this real-time approach. And during a trial, it can go from off to on to off and on again, depending on the real-time classification. And of course, that's what you heard already several times today. That's how the feedback loop is closed. You apply brain plasticity by stimulating the nervous pathways back to the brain while you're doing the motor imagery, and elicit the Hebbian plasticity to relearn the correct movements. Our recovery at home is our first Android app for Android tablets and smartphones. You can already find it in the Play Store of Google. Also, I will again on the last slide present the QR code for download. So for everyone who's interested and cannot find it in the Play Store, you can use the QR code. So what was the motivation about this at-home application? So many patients in our gyms in Austria and in other places, they asked us if there's anything they can do also while they're at home. That they thought, okay, maybe I come here 3 times a week, but maybe I can do even more to even increase the rehabilitation output. So that's why we created the Recoverix at Home application. It's important to say it's not a substitute for the Recoverix treatment. So it's not either you go to the gym or you do it at home. You should still go to the gym, receive there the real Recoverix treatment. And as a supplement, you can do at home the Recoverix at Home training. How does it look like? So once you have downloaded this application, you would see, this is the first screen that you would see. So it's a subscription model, but there's a 7 days free trial period. So you can try it within 7 days. If you don't like it, you don't have to pay anything. You can cancel the subscription and tell us your feedback why you didn't like it. After the 7 days, the subscription model would come into action. You pay about 30 euros per year, so it's a yearly subscription. Depending on the country and the local tax regulations, the 30 euros would be a little bit more or less, but that's about the pricing. It has a very easy user interface. You see here, you can select the type of feedback you want to see on the screen. So this is for the upper extremity rehabilitation, both hands, or you could switch to the lower extremities. So you would see here the left leg and the right hand, or the right leg and the left hand. Then you could already click on Start or go to the Settings menu. Settings menu, you can select the audio language. So you will have audio commands giving you the cue on which side of the body you should do the motor imagery in your own selected language. So saying either left, right, or links and rechts, or whatever your language is. And you could also select the length of one session, but also you can do as many sessions as you like and for as long as you are motivated. So important to say, in Recoverix at Home, we don't measure the brain signals. So you don't wear an EEG cap. Also, you don't have the FES stimulation. But you should still do the motor imagery following the cues that you receive from the auditory commands. And you will always receive the positive feedback. So the avatar will always move because we cannot detect if you're really doing the motor imagery or not. Apart from that, it looks like in the real Recoverix in the gym, the same avatar, the same movements. You see here the arrow pointing towards the direction you should do the motor imagery, right hand. And you see also this shining spot pointing on the side. So I don't show you now the how it looks like for the lower extremities, because you saw it already today in other sessions, where you would see the avatar in the mirror perspective, and you do again, motor imagery of the left or right leg versus the other opposite hand, receive always feedback, and that's it. So the benefit of this Recoverix at Home is that you increase the number of repetitions of motor imagery doing through your treatment. And as we know, because you just need a very high number of repetitions for relearning motor movements, the more repetitions you have in the gym and at home, the better your rehabilitation output will be. So as a summary, this Recoverix at Home is a supplement to the Recoverix therapy. You perform always the motor imagery and receive visual stimulation, no FES stimulation. You can choose the therapy kind. so hands only, or the left leg or the right leg. And your session length can be set to 6, 9, or 12 minutes. You can do as many sessions as you want, also in the free trial period, or of course afterwards in the subscription period. It's available worldwide, or almost worldwide, wherever the Google Play Store is active. We know there are a small number of countries where it's not active. And in many audio commands, here in alphabetic order, from Arabic to Turkish, Czech, Danish, Dutch, English, and so on. You can see it here. If there's a language missing, you can send us emails, request for it, and we can work on integrating your desired language. So most listeners here are not stroke patients, I think so, and not customers of our recovery gyms. But still, if you would like to try this app, I would be happy if you do it. So you can download it here on the Google Play Store via this QR code. And maybe you ask, what about Apple? Of course, we're working on that. It will come soon, the version for iPads and iPhones. Within some weeks, we will be able to probably release this version also. Next topic I would like to talk to you about is, as already mentioned, the gamification in the PCI rehabilitation. So, well, Javier already explained very well, I think, some ideas why gamification is a good thing. So you need this high number of repetitions, but if you always see a avatar just moving the hands or some other kind of feedback, it can be a little bit boring after what we are doing 25 sessions or however many sessions you're doing. That's why we introduce also game elements, give you some narratives, scores and awards to keep the higher motivation, to increase the satisfaction and the interest of the patients, and keep the compliance on a very high level. There are some caveats, of course. You should keep the benefits of the embodiment. So you should still show the avatar. You should have the idea, the embodiment, that what you see on the screen are your hands. We also had this in the talk before. You saw the hands throwing these balls. Here also in our games, you still see your hands or your legs, depending on the rehabilitation task. And also the game should not distract too much from the task. So you should be still focused on the motor imagery, not purely on the game, because in the end you want the perfect rehabilitation, and it should be still entertaining. So a lot of things to consider. This is our game that we have developed for the upper extremities. We call it Slap a Rat or Slap a Mouse. What you see here, as I said, you still see the hands of the patient in the first person's perspective, lying on the table or on the floor. But in the middle, you see this pile of pieces of cheese, and you see two holes on the left and the right where the rat will appear from, which means you still have the trials, either move your left or the right hand, depending on where the rat is coming from. And the rat wants to grab a piece of cheese. And the task of the patient is to not allow the rat to do that, to scare it away, to slap it. And how you do it, of course, you do the motor imagery. You try to move your hands in the right time on the right side so that the rat is scared. So I show you how this looks like. Click here and start. You see the rat disappearing and the motor measure is done. So the rat was scared away. It couldn't grab a piece of cheese. Now it comes from the left side. It's a left-hand side trial. Again, motor measure is done. And again, the rat is scared away. Now you will see a non-successful trial. There's no motor imagery, no motor movements. And the rat was able to run and grab a piece of cheese. Start this again and stop. So the score that we present to the patient is not an exact score, because we don't want the patients to maybe be depressed if you have 2% less score compared to the day before, or if your neighbor maybe performs a little bit better than you. But you have some kind of feedback in that sense that the pile of cheese will decrease if the rat is successful. There would be a smaller pile of cheese after the trial, but if you could defend it, then it will stay the same. This is our game for the lower extremities. We call it Drums Festival. You see here, different setting. We are out in the nature in maybe a music festival in the middle of Austria with the mountains in the background. And you again see your body or parts of your body in the first user's perspective. So now, because it's for the lower extremities, you would see, in this case, the right leg and the left hand. Of course, we can flip it so that you would see the left leg and the right hand. And you have these two drums that you have to play. So during each trial, a piece of music is played. And the task of the patient is to play the drum at the end of the trial that fits to this piece of music that you're listening to. So you do the motor imagery, and if you do it correctly, you're able to lift the stick, and then at the end of the trial, smash the drum, and then in this case have a successful trial. I just click on start here to show you how it looks like. So the cue, you need to know on which side you have to imagine the movement, of course. So the cue here is presented via the spotlight. So here, this is a right leg trial. You have the spotlight pointing to the extremity, and you also have these music notes coming out from the drum. So it's clear this was a left-hand trial. This is again a left-hand trial doing the left-hand motor imagery. And all these trials are successful in this video. You may have recognized, we have here a small audience of 4 people. And just in the beginning of the video, there was this boy appearing. So this is also a kind of positive feedback, a score. If you're playing correctly, if you play some trials correctly, then additional audience will appear in the background. So the better you play, the bigger your crowd will be in the end. On the other side, if you don't play correctly some trials, then people would disappear one after each other. It takes some trials until the next person would appear. I can scroll a little bit forward so you could see the next one. Soon there should be another appearance. Here it is. So now we have 5 persons. And so during a full rehabilitation, this would accumulate to a bigger crowd if you're doing really good. We also investigated the effects of this gamification in the rehabilitation. So what we did is we ran tests on 6 healthy subjects, but also 10 stroke patients, and compared standard Recurix treatment to the standard Recurix avatar to the game. And what we did is 2 things. we had a look if the BCI accuracy is negatively affected. This would mean that maybe the game is too distracting from the real task. And secondly, we also looked, of course, to the satisfaction level of satisfaction of the users to see if they enjoy playing the game. So for the PCI control accuracy, we have this plot. So you can see, okay, first we had the calibration accuracy, mean accuracy of all participants during the calibration run was 70%. Then we had the regular real-time feedback using the avatar, having a higher accuracy. That's not surprising. That with real-time feedback, you have higher accuracy than compared to calibration. And then we had the 3 sessions of game feedback. And you can see that game feedback is in the same range as the regular feedback. The first session was a little bit lower, but the 2 other sessions were even a little bit higher than the regular avatar feedback, which showed that the users, healthy control and patients had a good PCI control accuracy of the game. And also if we look at the user satisfaction, we asked them those 8 questions, giving answers from ranging from 1 to 5 points. And for example, you can see the easiness of use. In Q3 is this. We have here all users, healthy users, and the stroke users. Of course, stroke users, the easiness was a little bit lower. That's also not surprising, but it was still very high at 4 points. The clarity of rules is very high. It helped a lot in the concentration. That's Q6. Helped even more for the patients compared to the healthy users. And very important, it alleviated the boredom. This can be seen in question 6. And yeah, most of them said that games are a very good idea for this approach. So since this is the last talk of the day, it's a little bit shorter. It was a long day already, so I hope you don't mind. Here I present you again the QR codes. If you would like to download our RecoverX at home, use this QR code. Sorry, I switched to the laser pointer again. Use this QR code. And also again, the reminder to this invitation of the Frankfurt RecoverX Gym. Just scan this code if you would like to join there and register for the opening. That's all.
Thank you very much, Rupert, for the nice presentation.
My pleasure.
Which concludes the day very nicely, and I guess everything was super clear. Pleasure to have you. And tomorrow we are starting again at 9 a.m. Vienna time. Tomorrow is Mindbeagle Day. This means brain-computer interfaces for patients with unresponsive wakefulness and coma patients. So we will show you how to record EEG data, calibrate PCI systems to work with these patients, how to extract biomarkers, and also to do neurorehabilitation treatments for these patients. And Rupert will show you the Mindbeagle system working tomorrow. I hope, at least. Rupert, are you?
No, Ren will do it.
Ren will do it. What are you doing tomorrow?
ERP analysis using GPS Analyze.
That's good. Otherwise, I would have spoken with your boss if you didn't get the task for tomorrow.
Yeah, should have a serious word.
Thank you very much. It was nice. Enjoy the evening. Bye-bye.